Okay, hey, I'm Dwayne, and this is my wife Veronica, and we're going to be doing our respiratory assessment. We're going to start off here with first inspecting the thorax. I'm looking at her normal breathing to make sure everything's symmetrical and there's nothing out of place. She would usually have on like a tank top or something so I can see, but I'm looking to see if she's having any retractions or any trouble breathing at all in any way. All right, so the next thing we're going to do is we're going to palpate the thorax as she breathes. So we're going to come here. You want to turn to the side for me? I'm gonna place my hands on the outside, and I'm just gonna feel here and just take some normal breaths for me. And so we're making sure that everything feels normal and she has equal expansion on both sides. All right. I'm looking at her skin, making sure her skin is good and everything's not in order, and making sure everything here again looks symmetrical. All right. So now we're gonna move on to assess for tactile firmness. This is where I'm gonna place my hands on her back. Again, she's gonna turn, and when she feels me touch her back, she's just gonna say the word 99.
99, 99, 99, 99, 99, 99, 99.
Okay. All right. So the next thing we're gonna do here is we're gonna turn her and have her. We're gonna do the chest percussion from the anterior portion of her chest. So you're gonna feel me tapping on your chest here. It's kind of palpate the abdomen, but it should be a duller sound over the organs. Okay, we're going to turn this way and do the back. So you guys can see. While this we're doing too, we're going to try to mark the outline of the diaphragm on the front as well. Okay, you going to turn for me? All right. So next thing we're going to do, we're going to auscultate. All right. So we'll do the anterior portion first. Whenever you feel my stethoscope touch, you take a deep breath in now. Okay, we're going to do the same thing posterior. Okay, the next thing we're going to do is we're going to test for gaphany. So what you're going to do is you're going to say the word 99 every time you feel my stethoscope touch you, okay? Well, say E, I'm sorry. You're going to say E.
E, 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 E.
Okay, we're going to do it right here in the front as well.
E, 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 E.
Okay. All right. The next thing we're going to do is we're going to do the whispered test. She's going to say 99 every time I do touch the back with her stethoscope.
99, 99, 99.
Oh, whisper it.
Okay. 99.
We're doing this posterior and anterior. Okay, you're gonna turn again in the front. Okay, the next thing we're gonna do is we're gonna test for bronchopnea, and she's gonna say 99 every time we do it, but she's gonna say it louder this time.
99, 99, 99, 99, 99, 99, 99, 99, 99,
Okay, we're gonna turn again.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. All right. All right, that concludes our test. We're making sure that she doesn't have any type of issues as far as like pneumonia or emphysema or anything like that, and her skin looks good. And if she had any breathing problems or difficulty, I'd be able to tell during the assessment.